for more on the Omicron variant, I'm joined by Dr. Ziyad Al-Aly. He's the Director of the Clinical Epidemiology Center and the Chief of Research and Education Service at Veterans Affairs St. Louis Healthcare System. Welcome to the program.
Well, thank you for having me. Delighted to be with you.
Well, we've so many questions to go through. The WHO calls this a variant of concern. So really, Doctor, what do we know? Is it spreading more quickly? Are cases more severe? And how different is it from the Delta variant?
So what we so far know is that this is really a new variant that in the very early phase of our investigation about it, it really seems to be outcompeting Delta. So it seems to be a little bit faster spreading than Delta. Concern is that this may be more transmissible than the Delta variant. And really the most pressing concern is that it has so many mutations that it actually might evade current vaccine and actually might even infect people who had been previously infected with SARS-CoV-2, the old variants. So again, this is also a preliminary. This is really early investigation into what this new variant of the virus represents. But so far, it's disconcerting. It's certainly a variant of concern.
Doctor, I know this is still early days for us, but if you've just mentioned if it's more transmissible, it could possibly evade, vaccines, and you have a higher risk of reinfection. So really, all of us should not be complacent.
Well, absolutely not. Absolutely not. You're right on point. This is definitely a cause for concern, and it couldn't have come this came at the wrong time. This is really the start of the holiday season in the U.S. It started the winter where people congregate inside in large numbers. It also came at a time where vaccine effectiveness has been waning in people who had been vaccinated. And of course, we know a significant chunk of people in the U.S. and also people abroad have not even gotten a first dose of the vaccine yet. So certainly it's a variant of concern, and really it certainly is coming to us at absolutely the wrong time, and we should not be complacent about it. I think action is really required, and urgent action is required to try to contain it to the extent possible.
Can we possibly try to theorize why these mutations are happening now? Is it also driven in part because vaccination rates, especially outside developed countries, remain quite low?
Well, that's possible. The viruses mutate. Viruses mutate, and I think I always have said previously that we were lucky that the Delta variant and prior variants were actually responsive to the vaccine. And this time, maybe we ran out of luck, and maybe the virus now mutated so much, actually in excess of 30 mutations in both the spike protein and another very important region of the virus we call the RBD region. So it has so many mutations now, it might be immune evading, and it might evade the immune system, and that even people who had been vaccinated may no longer be protected, from the virus. So it's again, this is really bad news, and it came at absolutely the wrong time in America and in the Western Hemisphere.
Dr. Ziyad Al-Aly, so many more questions, but we have to leave it there. Thank you so much for your time and insight.